All right, hi guys, my name is Catie Edmonson. I am the editor-in-chief of the Columbia Daily Spectator, and I'm going to be talking a little bit about something that we've unfortunately had to deal with a lot this past year, which is reporting on student suicides. So this has been a really difficult year, academic year at Columbia. There has been a series of students who have died by suicide. By the time there had been 3 students who passed away in the first semester, we had begun working on an in-depth story about suicide at Columbia, and we were preparing to publish that story when in that week there were 3 students who passed away, all within the span of 7 days. So at that point, we decided that we were going to pause and take a week to sort of think over our story again and give the community some time as well to process. At the time, the New York Post happened to decide that they wanted to cover this quite a bit as well. So they were calling us quite a bit. They came to our office after we told them we didn't want to speak with them and didn't want to be quoted in their article. So at the time, it felt like there was a lot of pressure. There were a lot of comments on these articles that were asking, why aren't you guys writing about this? For us, it was really important to take that week and really be very deliberate with our reporting and the language that we were using. So one just big takeaway from this that I would advise is just be really cautious. If you notice in these headlines, it doesn't specify, with the exception of one headline, the cause by which these students died. And that's because it's pretty typical for our university not to disclose the cause of death when students pass away. So one of the questions that we had was that after all of these rumors were swirling about the cause of these students' death, right, what was the actual scope of this problem here at Columbia? How do we compare to our peer institutions? We wanted to look at the resources in place available to students who were struggling with mental health and the policies that were in place to see if they were adequate and aligned with best practices. We wanted to look at who was affected by this and who was most at risk. And we were wondering, why is this happening specifically this year? So we were able to answer a lot of these questions. We weren't able to answer some, and we're still continuing to look to answer some of them with our coverage now. But one of the first things that we did, and this list was initially much longer, was that we compiled a list of students who passed away while they were enrolled at Columbia over the past 16 years. And then what we did was, either by speaking with their family or using public records, we went and tried to confirm their cause of death and actually put a number to how frequent it was for students to pass away by suicide at Columbia. We were also really interested in looking at the demographics of these students. And something that we found, and that you can see just by looking at the spreadsheet, is that it was overwhelmingly students of color who were dying by suicide, and that it was common for international students to also struggle with this issue. So in terms of the people that we were talking to, we spoke with a lot of experts. We spoke with, I would say, over half a dozen experts, trying to understand from them what best practices for prevention are, what best practices for postvention, that's how the university responds after a death occurs, what those were, to try to figure out how closely what our administration was doing aligned with these practices. We spoke with a number of administrators, including the administrator in charge of our counseling and psychological services. We spoke with the dean of the college and the dean of student life. We also had several conversations with communications for the university to tell them about the story that we were writing and how we were planning on approaching it. We were encouraged at one point to write a story broadly about mental health rather than focusing on suicide, which is something that we decided to focus on mental health, but we also had to write the story about suicides in particular. And so we ended up writing a series of stories. The first was sort of an explainer talking about why it was that the university often didn't disclose the cause of death. And that was because a lot of times the families don't want that information to be public. That was a point that was really upsetting to a lot of students. They felt that the administration was trying to hide the fact that there were so many students struggling with mental health. So we first wrote an explainer talking about why the university had this policy of not disclosing cause of death. We wrote a story looking at how students of color and international students in particular were disproportionately at risk for suicide, and talked to experts about how this aligned with national trends, as well as looking at resources in particular at Columbia that were available for students of color. And then we also had a lot of op-eds as well as a staff editorial talking about what we could do as a community to try to address this issue. But the last and the biggest story I would say that we wrote was about how our prevention policies at Columbia aligned with best practices. And the answer was that while we were doing many things right, there were a lot of gaps. Specifically looking at gatekeeper prevention, when we spoke with the families of students who had died by suicide, there was one interview in particular, and some of the families were willing to talk to us and would talk to us for hours telling us about their children. Some of them didn't want to talk with us, but one interview in particular that stood out was a mom who said, my son was a first year, and I don't really know who his friends were. I don't really know who was looking out for him. And I just wish that someone had sort of seen that things weren't okay with him and was able to help him. So we're really looking at gatekeeper training, which is who is on campus, who has training to look for signs that a student could be struggling. And this article found that there were several things that experts advise can be very helpful that we weren't doing. So we published this story, and 1 week later, the university announced that faculty would be given gatekeeper training. It would be mandatory for advisors at the university to receive gatekeeper training, and that students would be able to receive this training if they liked as well. So the overall takeaways for this, the one thing that I wish we would have done differently is that I did have one reporter really leading coverage on this. In hindsight, I wish that I would have rotated reporters on this a bit more because it did get to be emotional for him. In general, not sensationalizing the issue, using very precise language. We actually had an expert look over some of the graphs that we wrote to ensure that we were using correct language that wouldn't be inflammatory. And the last thing is just continue to ask yourself, why is this a story? Do we need to publish this now? Can we take more time with this? That's sort of the general takeaways from this difficult past year. If you guys have any questions, I'm happy to answer them. Okay, thank you.